subscribe to OMYA Fertility and press the bell icon to never miss an update.
So, after the baby is born, does the mother experience any post-pregnancy features which could otherwise be alarming for, people who don't suffer from PCOS or endometriosis, but are actually common for someone diagnosed with, these two diseases? And if that is the case, how can that be dealt with?
Okay, the post-pregnancy also, since a patient with a PCOS have more chances of getting diabetes, obesity, so you have to get your regular blood pressure, your sugar profile and your obesity on check. What happens after post-pregnancy, you have that feel you will eat a lot, you will gain a weight. So your hormonal disorders become worsen.
Oh, okay.
And some patients have postpartum depression also. Oh. So, it's very common nowadays also with postpartum depression also. So you have to keep a check on all these things. You don't have to eat too much of things. You should not gain weight. You should check your blood pressure regularly. These are things which are most important postpartum.
So basically you should have a healthy diet and then you should exercise as much as you can and come back to the lifestyle that you were most likely living before pregnancy, right? With PCOS.
I can only say one thing, that lifestyle is very important for before starting a pregnancy, during your pregnancy and after your pregnancy.
After also, yes. बच्चे का ध्यान रखना is no mean feat. You have to be healthy, fit in mind and body to do that, of course. What about endometriosis, Dr. Seema? Because कई बारी ना we hear this, a lot of us girls hear this from our mothers that एक बारी you have your kid, तो आपको इतना दर्द नहीं होगा periods में. Is that true? Is that something that happens, or it's just a myth? कि मतलब like how people say कि शादी में प्रॉब्लम आ रही है तो बच्चा कर दो सब सही हो जाएगा. Is that something?
It is not like that. It happens that since your uterus is once you conceive, your uterus goes to a size and then come back to a normal. So most of your hormones which were deranged comes to a normal level. So this is only a thing which we can say, कि your hormones come to a normal level. Your cycles become more regular after conception. Since changes in the body are overcome. Once you conceive, your ovulation and everything becomes better. So this is the reason that people say कि you will have no pain or something.
Okay. So basically there is some truth in it. जो हमारी माएं हमें कहती हैं, there is some truth in it.
But everyone wants to delay a pregnancy nowadays. So they go for different options for it also, like egg freezing and all these things.
True, but among so many myths, only if we knew that this was actually not a myth, that period you get easier. Only if we knew. Anyway, there is also this belief that if you get medication, lifestyle, everything in order, or even have a baby, you can reverse these diseases. कि मतलब ये disease होगा ही नहीं. Is that true? And what are the lifestyle changes, a female can adapt to help treat PCOS and endometriosis? This is my last question. इसके बाद मैं आपको और तंग नहीं करूँगी, लेकिन ये बहुत important सवाल है.
I feel it's very important for the lifestyle. I told you कि if your lifestyle and your dietary habits are good, then these symptoms of your hormones can be reversed back. PCOS is a hormonal disorder. I told you, your ovaries, your hormones become irregular, which causes all these symptoms. The most important lifestyle is your exercise part. You have to do an exercise daily. You have to control your weight. Exercise means either the gymming, either the walking, either the yoga.
Yeah.
And that too around 5 days a week.
Oh, wow. Okay.
And minimum half an hour, I can say that. So that controls your weight. Again, a dietary habit, less of carbohydrates, more of proteins in your diet, more of healthy food, less of junk food, no bakery products, no biscuits, less of milk products. And milk product means you have more of charge, more of toned milk. So these are the most important things. What is now? No pizzas, no biscuits.
You should be the, Gabru gym boy. उनकी जैसी diet होनी चाहिए आपकी. No, but
no. Healthy boy. Then you have a healthy baby, na.
You're right. No, actually, you're right. But ये joke मारना थोड़ा जरूरी था क्योंकि we have to normalize this thing कि हम junk food नहीं खा सकते. That we cannot.
तो junk food में ऐसा नहीं है. You cannot eat the junk food daily, ना.
हाँ, you can't eat it. अच्छा, ये तो PCOS we've covered. Now with endometriosis, is there a way to reverse this disease? Does that happen?
It's very difficult to reverse the endometriosis. Lifestyle, you have to improve your lifestyle. You have to a good diet. You have to maintain your hemoglobin. You have to maintain a healthy. You have to do an exercise. That is one part of endometriosis, but you cannot reverse it. There are some medications to suppress endometriosis.
Okay. Is there any advice that you'd like to, give couples who do face these diseases together, when they are trying to conceive a child? Is there anything that they can do for themselves, for each other, to make life easier?
I would like to say that they should not feel disheartened if they cannot conceive. They can conceive with their own eggs. They have to get it rightly treated. They have to maintain a lifestyle, which is a healthy lifestyle, I can say that. Right. And they have to take a proper treatment for it. See, you cannot think, okay, I'll do it for a month and then everything will be okay. It's a continuous process. Any treatment is a continuous process. So you should not be disheartened you will not have a baby. You can have a baby. In both the cases, whether it be PCOS or endometriosis, you can conceive with your own eggs, with your own genetic child.
And I think another thing that I would really like to add over here, since you also mentioned, Dr. Seema also mentioned postpartum depression, I would definitely like to add that a lot of times, we don't consider these kind of mental health issues to crop up because having a baby is such a, beautiful process. It's such a happy period in the couple's lives and it's such an exciting period that we just tend to not think about it. But if there are any signs, then, of depression, then we must support each other emotionally. We must find out ki kuch gadbad hai ki nahi, and we must be able to support each other emotionally.
That's very important part.
Yeah. So, thank you so much, Dr. Seema, for your time. This was a, very, very insightful chat. And I'm sure it's a lot to digest. But now that we have a better understanding of, these ovarian or endometrium disorders, it will most likely be slightly easier for couples who are most likely suffering from these diseases. Thank you so much again.
Thank you so much, Diti. It was a nice interaction with you, and I hope I can help out some couples in this thing. And I would, in the end, say, please don't delay your pregnancy, and you can plan up a pregnancy. And if you're not planning, you can go for embryo freezing or egg freezing if you want to delay.
Yes, absolutely. Again, thank you so much, Dr. Seema. That's it for this episode. We'll be back with another one super soon. Until then, chin up, yaar.